Well, I got bored at home and decided to come to the office and spend a few minutes thinking about my patients and how much we really appreciate you guys and we miss seeing you. We miss being open. But as you know, we've been asked to not do that for this particular time. Now, having said that, that doesn't mean that I can't see patients because I have seen several of you that have had tooth issues. So please, if you have any questions or are in pain especially, give me a call and we'll get back with you as soon as we can. We check messages several times a day. So one of the things I wanted to do today is just to share with you a little bit about something new that we've been asked to do, which is to wear a mask in public. Now, the one thing they did say, just for completeness sake, is that you can wear anything that fits over your mouth and your nose, and that would be it would be just like a mask. It could be a scarf, it could be just even a blanket or a piece of cloth, or there are all kinds of things that you could wear, and that's great. All right, but if there are those of you that would like to buy some of these, you can go to the store and acquire them if possible. I'd like to take a minute just to show you how the proper way is that we recommend that you wear a mask, okay? The first thing that's important to do is to notice that there's just a little tiny metal strip right here. And what I like to do is open them up and then put it out on my nose like this and press down a little bit. Then I go over and I put it around my ears. There are different ways, different masks have different ways to do that. But here are a couple of things that are important. Number one, you want to make sure that this metal piece molds to your face as much as you possibly can. Okay? You don't want any air sneaking up through here at all. In fact, one of the ways to tell if a mask is done correctly is if you can actually see a little bit of a bulge as you breathe out. It tells us that the mask is pretty well sealed because you want it sealed around here, you want it on the sides, you can even bend that a little bit like that, and especially up here. So that's how to wear a mask. It is a little bit claustrophobic, especially in the beginning when you start trying to wear them, but it's definitely worth your safety. Now, the other thing that's really important that people oftentimes miss is these two things right here. We call them eyes. Okay, they are big holes and they are open and vulnerable to viruses and other things like that. So just because you have your mouth and nose covered, don't go to sleep, so to speak, thinking that your eyes are going to be okay. I would recommend either a small pair of glasses that are kind of close fitting like that, or even better yet, if you would like to get some goggles, that would be good. So anyway, glad you're safe. We'll be open as soon as we possibly can. Again, don't think that you can't call us if you have a problem. We will get back with you. And anyway, stay healthy, stay at home. See ya.